MRCS point of view, foramen ovale, you should know a few things about it. Now, as you know that when the heart is developing, there are basically four chambers. Now, so there is an endocardial question. So, if for developing, for dividing atria into two, there is an uh, uh, a primary sort of septum developing called septum primum. So when this septum primum is developing, it leaves or it has a hole. This hole is called foramen secundum. Okay, so I'm gonna only draw this portion from now on. Now you should know. So as this portion has a hole which is called foramen secundum, but it and this developing thing is called septum primum. Okay, so there's an another layer developed which called septum secundum. So you should know is that there is a small sort of irreversible wall formation. So if the blood tries to go from right side to left side, it can go. Okay, but when it tries to go from left to right, it can't go. So it acts as a wall, and this whole structure is called foramen ovale. So at the time of birth, there is a thing which happened, which is very important. As the baby is born, the pulmonary blood flow increases, which ultimately leads to right and left chambers. So there will be an increased pressure in left chamber, which will ultimately, what will happen when there's a wall. This is the wall, and this is the second wall. So what happens is that it increases the pressure and it pushes this thing to attach with the second one, the septum primum, secundum. They fuse with each other, and that hole is obliterated, and that's very important. If it doesn't do happen during the birth, patient is gonna having a ASD, atrial septal defect. And one thing more important, that is this the defect which actually ultimately fuses leaves a scar mark, or you can say a dent in it, which is called fossa ovalis. So the remnant can be seen in adult life, and that defect is called fossa ovalis, that fusion sort of thing. And the one thing which is more important is that these two fusions, or the reversibility, or you can say the valve like structure which has actually formed, it's very important for fetal circulation.